Welcome to Best Hearing Solutions. If you're experiencing buzzing, chirping, or ringing noises in your ears, you're probably wanting relief. So get ready for some helpful information.
Best Hearing Aid Solutions, providing practical advice for better hearing.
That persistent ringing and buzzing sound that you're hearing is known as tinnitus or tinnitus, and it impacts millions of people around the world. When this happens, it's important to get in touch with a hearing health specialist, as they'll be able to get to the bottom of the tinnitus you're experiencing and make some helpful suggestions for remedies or solutions. So what is tinnitus? Tinnitus is commonly described as ringing in the ears, but some people with it describe the noises they hear as buzzing or roaring or whistling and even music. The sound that you hear doesn't define tinnitus. Instead, tinnitus is a condition that's distinguished by sounds that have no external source. You may think that you're the only person in the world experiencing tinnitus. However, you're not alone. It's a very common condition. About 15% of the population experience some sort of tinnitus during their life. Often, this is a symptom of hearing loss. The fact is that 80% of people with hearing loss will also experience tinnitus. So why do I have tinnitus? That's a question that we commonly hear from our patients as they wonder what caused that constant or intermittent ringing. Well, tinnitus is really a symptom rather than a disease in itself. It can be caused by exposure to loud sound or trauma to the jaw or the ear, and a number of lifestyle habits such as excessive caffeine or even stress can aggravate tinnitus. Uncontrolled high blood pressure and a few other physical conditions can also result in tinnitus. Typically, though, undiagnosed hearing loss is the most common cause of tinnitus. You see, hearing loss lowers the brain's auditory stimulation. Researchers and scientists believe that when sufficient stimulation isn't received by the brain, it creates something to fill the void. Basically, that means that when your brain doesn't hear certain sounds, it just sort of makes them up. Regardless of the cause of tinnitus, finding the right form of relief is crucial. So how do we treat tinnitus? Now that you have a better understanding of tinnitus, let's talk about different treatment options. Despite what you're probably reading online, unfortunately, there is no potion, pill, or powder that's going to cure your tinnitus. However, there are treatment options that can make it a lot easier to live with tinnitus, helping to manage the tinnitus symptoms. And hearing healthcare specialists are leading the charge when it comes to discovering tinnitus treatments. As a hearing healthcare provider, one of the things we also offer is coaching and counseling to our patients. It's important how the patient sees themselves in relation to the tinnitus, not as a tinnitus sufferer, but as someone who's managing their symptoms. Also, the most effective treatment is providing amplification in those precise frequency ranges where the tinnitus exists, and likely a hearing loss along with it. This is done by conducting a thorough hearing evaluation and fitting the patient with a hearing aid that's programmed specifically for their needs. The hearing aids do their work by helping return the auditory input to a level that's considered normal. For instance, once the background noise is restored to a level that's audible, and the tinnitus will fade into the background. As the brain is busy processing signals that do exist, it'll be too busy to focus on the signals that don't. For times when a client can't wear hearing aids, a white noise generator may be useful. For times when you're taking a shower or going to bed at night and can't wear the hearing aid. Also, behavioral and cognitive therapies are effective for some types of tinnitus. Tinnitus retraining therapy combines a number of behavioral and cognitive concepts, teaching the individual with tinnitus how to override the sounds they're hearing. It can be very successful, especially when paired in tandem with other treatment options. If you're experiencing tinnitus, there are some things that you definitely should not do. Some of them are continuously watching videos about tinnitus, worrying about it, and reading about it. It may sound kind of strange, but obsessive focus on tinnitus can actually make the problem worse. But decisive action can make it better. You see, like most things in life, getting relief from tinnitus doesn't happen as a result of what we ponder and worry about. Getting relief is a direct result of what we do. Taking direct action is what brings about results. So if you have tinnitus, the best thing you can do is schedule an appointment with a specialist as soon as possible. The specialist will be able to carry out a series of auditory tests and then recommend some treatment options. And if you're in the Houston metro area dealing with tinnitus, get in touch with Best Hearing Solutions as soon as possible. Schedule your free hearing test and consultation. The number to call is 713-322-8315. We've helped thousands of patients over the years, and we're here to help you too. Thanks for watching, and if you like this video, be sure to click the subscribe button. And if you click the little bell, you'll receive notifications whenever we produce a new video. Thanks again.
Best Hearing Aid Solutions, providing practical advice for better hearing.